I think when I'm talking about inequality too, it's not just economic or financial inequality. There's also inequitable access to government services in our province. And that's something that we have to address. And we're going to have to think differently if we do that properly. There has always been a challenge, not just recruiting family physicians to rural Nova Scotia, but retaining them. We now have an issue where less doctors are getting into family practice, and the ones that are taking on less patients. They're practicing very differently. Where we had the old guard docs that were taking 3,000 to 5,000 patients, probably too much. Newer docs, some are taking 300 to 500 to 1,000 patients. And less of them are getting into family practice in rural Nova Scotia. So we really have to rethink our access points to primary care. We have pharmacies in every single part of this province. I learned that when I oversaw the implementation of the most equitable vaccine rollout program in the country. We need to rely on them to do more prescription renewals, to order blood work and blood tests and lab tests for patients. We have to look at alternative access points for people. We cannot rely on the old system here. It's imperative if people are going to access care at a time when the biggest demographic bulge is coming through the healthcare system at the same time that there's a labor shortage. If we're not getting more from other folks in the system, that system will continue to be overwhelmed. By the way, that system has gotten demonstrably worse since the Conservatives have taken office. And I do have to point out, their management of COVID-19 has been key to that. So I dare the Premier to blame us for the work we did in health and why we have this situation in healthcare. When you tell everyone to get back out there in the midst of the most deadly 2 waves of COVID-19,
Thank you, Mr. Churchill.
take information from people, you're going to have trouble.